Hi, I'm Frandalina Cero, a grade 10 student who's passionate about reproductive health education.
Did you know that according to the Department of Health 2024, over 10 million Filipino women face the risk of unwanted pregnancy and lack access to family planning? In addition, it is alarming to know that sexually transmitted infections are one of the leading concerns for public health, yet many avoid talking about them or just unaware of the risks. These realities show the urgent need for more information drive on utilizing contraceptive measures for family planning and safe sex practices.
Today, I will not only discuss preventive measures for unintended pregnancies but also for STIs and STDs. First of all, what is family planning? According to the World Health Organization, it is the practice of using contraceptive methods to control the number and spacing of pregnancies. Wherein contraception, also known as family planning or birth control, is defined as an intervention that reduces the chance of pregnancy after sexual intercourse. Now, I will walk you through different contraceptive methods included in the WHO guidelines. First is the long-acting reversible contraception, which includes implants and intrauterine devices that are highly effective and last long. Both methods can easily be removed by a healthcare provider and won't stop your chance of getting pregnant in the future. Second are the short-acting methods such as injections, pills, and vaginal rings. These are recommended for temporary prevention of pregnancy. Just make sure not to forget or delay the use because their effectiveness can drop to around 93%. Third are the barrier methods like condoms and diaphragms. This method prevents sperm from getting into the uterus by blocking the exchange of body fluids during sexual intercourse. Fourth is sterilization, a permanent method of contraception that involves surgical procedure. It comes in two types, tubal ligation for females and vasectomy for males. Fifth is the natural family planning or fertility awareness method, which are built on trust between partners and on individuals' ability to avoid intercourse during peak fertility. Sixth is the withdrawal method, where the penis is withdrawn from the vagina before ejaculation. This method, however, is not that reliable. Last is the emergency contraception, which is used after unprotected sex. Commonly used are copper IUD and emergency contraceptive pill. When choosing the right contraceptive method, the pros and cons should always be weighed. Consider how each method meets your current and future needs. Now that we understand the use of contraceptive measures for family planning, let's shift our focus to STI and STD prevention. Sex is a beautiful way to express intimacy and is a natural part of life. However, it can also increase the risk of acquiring STIs when safe sex practices are ignored and when one has multiple partners. So, to prevent both STIs and STDs, we should be informed that condoms are the only contraceptive method that reduces the risk. Other ways are through abstinence, which means avoiding sexual intercourse before marriage, and having one faithful, uninfected partner, or also known as mutual monogamy. In addition, getting vaccinations that protects against hepatitis B and HPV, avoiding sharing unsterilized equipment, consulting a doctor, and increasing awareness to understand how infections spread can all help prevent. In conclusion, it is important to communicate with your partner, stay informed, and consult a reproductive health professional. We must also educate ourselves about safer sexual health practices and promote making healthy, informed choices.